We were very close. We always spent time together, go on vacation. Tanya would always be like, okay, I'm gonna sit in the middle in the back seat so you two don't fight. She was always there for everybody. She would take me with all of her older friends. We would all just go hang out. It was nice having a really older sister to be with.
She'd had a really rough night because she had woke up just vomiting a lot over and over and up and down since about 3 o'clock in the morning. Well, it was weird because by 10 o'clock that morning, all of a sudden she actually felt a little better. I had made her some hot tea and toast and went down and sat on the bed with her in her room, and we sat there and laughed and talked. And so, we had her a doctor's appointment, but they couldn't get her in until 4 o'clock later that day. She had slept a lot, and if she stood up at all, she would throw up. She just couldn't keep anything down. It wasn't until 5 o'clock that she called me in, and she had those spots. She had them from her head to her toe, just random, all over. So from the time she really had the spots and we knew it was meningitis at 5 o'clock in the evening, she died at 7 o'clock the next morning.
It's something that may completely change your life and the way you see things and see other people. It's extremely difficult.
In my eyes, she was, we were catching it. We were doing everything right,
Early on in the disease, it's very hard to tell. The signs and symptoms of meningococcal disease can be just like the flu.
Did you know that not all the symptoms happen at the same time? The symptoms may include high fever, headache, stiff neck, vomiting, confusion, sensitivity to light, extreme weakness, and as the person gets worse, seizures.
Lauren was charismatic, effervescent, loving, caring, fun. You just wanted to be around her. She loved Disneyland. She liked dressing up like a princess and going and being properly treated as a princess. When Lauren got sick, we had gone to the snow on Saturday, and on Sunday she started just to get a cold. And on Monday she was actually fine. I didn't see anything, so she went to school. And on Tuesday she didn't feel good and kind of had a fever, and I didn't know what it was. She had had earaches previously, so we just went to the doctor. She had a temperature of about 101. They said, well, it looks like she's heading for the flu. Expect a high temperature for the next couple of days. Well, at about 1 o'clock, the fever came back and she became angry and almost delusional. It was so hot of a fever, I couldn't help her anymore. So we called an ambulance. She had actually had some pretty bad seizures in the emergency room. They had already diagnosed her with meningitis. They had already done the spinal tap, and the prognosis was not good. She went in a coma, and I had some of the best specialists fly in from New York and Chicago. I had neurological tests done, and the one that made me believe was a test in which you can see where the strands of lights go, and there weren't any lights going on anymore. They were all dark. And so I knew I had to let her go. They asked me, when did we want to take her off life support? It's a really tough question to answer. And I brought in everything pink that she owned. I brought in her Barbie collection. And I put her Cinderella dress on, and I put her red shoes on, and I invited anybody who loved her to come say goodbye.
It has been observed that meningococcal meningitis is such a dangerous disease, which progresses so rapidly that it is possible for an otherwise healthy person to be alive at breakfast and dead by dinner.
Mary Jo was a very unusual teen. She was vibrant, multi-talented, committed, and a beautiful person inside and outside.
She was very kind, considerate. Many of her friends talked about how they'd go to her for advice and when they had problems.
On a Saturday morning, she came to our room and complained of a sore throat. I got my heavy-duty flashlight, looked at her throat, did not see anything unusual, no redness, no swelling, no blotches. But when I felt her, she felt warm. I had to go to work, so I told her I was just going to call her every 4 hours, check on her condition, but to call me if she gets worse. I called her at 9 a.m. I asked how she was doing, and she said she felt a little weak. So I told her just stay inside the house. At 2:30 p.m. the phone rang. When I picked it up, it was Mary Jo, and she said, "Mommy, I have brown spots on my face." And I told her, I said, "I'm coming home." On my way home, I was thinking, she hasn't been feeling well. Now she has brown spots on her face. I said, "Oh my goodness, she has meningitis." When I got home, I found Mary Jo sitting on the sofa, still awake, alert, and talking. But when I looked at her face, the brownish spots had changed to purplish blotches. I called 911 right away. When we got to the emergency room, they've started 2 IV meds, intravenous lines on both arms, and they were just gonna do a spinal tap.
She encountered meningitis 8 days before she was 16 years of age. And yet, when meningitis hit, it was 13 hours from the time she experienced a sore throat to the time she was pronounced dead.